Go.
Hi, my name is Ken, and I'll be explaining the arteries of the cat above the diaphragm.
Go.
The coronary arteries can be found on the surface of the heart. It supplies blood to the myocardium. The pulmonary trunk extends anteriorly from the right ventricle and the right and left pulmonary arteries. It carries blood from the right ventricle of the heart.
Yeah, go.
The ascending aortic branch starts in the left ventricle and extends to the aortic arch. It supplies blood to the myocardium.
Go.
The aortic arch branches off into brachiocephalic artery and the left subclavian artery.
Go.
The descending aorta extends from the chest into the abdomen. The descending aorta begins at the aortic arch and continues down to the thoracic and abdomen area.
Go.
The brachiocephalic trunk branches off from the aortic arch and splits into the right subclavian artery and the right common carotid artery, which supplies blood to the head. The left subclavian artery begins at the aortic arch and branches from the aortic arch and supplies blood to the extremities, the left side. We can find the subscapular artery right here, and it supplies blood to the shoulder muscles of the dorsal arm and the scapula. The axillary arteries becomes the brachial artery. As it becomes the brachial artery, it supplies the forelimbs and foot and gives rise as it enters to the arms and biceps and triceps of the muscle. The axillary artery gives rise to the brachial artery, and it supplies the biceps and the triceps of the arm muscles.
Catalina, and I'm doing the arteries below the diaphragm.
The celiac artery trunk is the first major branch of the abdominal aorta. It's right here. The celiac artery trunk is the first major branch of the abdominal aorta. It supplies the blood to the stomach, the liver, the spleen, and part of the esophagus that reaches into the abdomen. The superior mesenteric artery is a major blood vessel in the digestive system. This artery branches off of the abdominal aorta, and it services the pancreas and the lower part of the intestine. Artery. There are two blood vessels leading off from the abdominal aorta, which is located in the abdominal section of the heart's major artery, and go to the kidneys. The renal artery is one of these two blood vessels. The inferior mesenteric artery provides blood supply to the third segment of the left side of the transverse colon. It also supplies the sigmoid colon with blood. The external iliac artery provides the main blood supply to the legs. It passes beneath the inguinal ligament in the lower part of the abdomen and becomes the femoral artery. The internal iliac artery divides into smaller branches to supply the various pelvic muscles and tissue structures, as well as the gluteal muscles and the external genitalia. The femoral artery is the main artery that provides oxygenated blood to the tissues of the leg. It passes through the deep tissue of the femoral region of the leg, parallel to the femur. Ready, set, go. The proximal caudal femoral artery is the second branch from the femoral artery, branching at the mid-thigh region and supplying the pectineus, adductor muscle, and gracilis. The saphenous artery is the last branch, most distal of the femoral. It usually lies between the sartorius and the gracilis muscle and supplies their distal ends. The popliteal artery, deep to the knee, extends off the femoral artery and is located in the knee and the back of the leg.
Hi, my name is Leah Danulian, and I will be discussing the veins of the cat below the diaphragm. So we're going to start, so this is the diaphragm, and below it we see, or right here, And this is like above the diaphragm, but I'm trying to show that this is the inferior vena cava, and the function of that vein is that it takes the oxygenated blood from the lower half of the body and brings it to the right atria. So the hepatic vein, which moves deoxygenated blood out of the liver, is right here. And then over here, this right here is the hepatic portal vein, and it carries blood to the liver from the spleen and the gastrointestinal tract. This right here is the gastrosplenic vein, and this is the superior mesenteric vein, and the superior mesenteric vein it supplies the small intestine and most of the large intestine. And then the inferior mesenteric vein is this right here. And the inferior mesenteric is an unpaired thin vessel arising from the ventral surface of the aorta posterior to the gonadal arteries. Okay, so here and right here, this one and this one, is the renal vein, and there are two of them, the left and the right, and they both branch off the inferior vena cava and drain deoxygenated blood from the kidneys. So then we're gonna move to this area. Wait, can you pause it real quick?
Hi, I'm Catalina Montesioca, and I'll be discussing the veins above the diaphragm. Okay, so we have the coronary veins, and those are these blue lines right here in the heart. And those are a collection of veins joined together to form a large vessel that collects blood from the heart muscle, the myocardium. It delivers deoxygenated blood to the right atrium, as to the superior and inferior vena cava. So this is the superior vena cava, and this is, superior vena cava vein, and this is the superior or inferior vena cava vein as well, which is slightly torn off there. And the superior vena cava is a large diameter yet short, and that vein carries deoxygenated blood from the upper half of the body to the heart's right atrium. The inferior vena cava is a large vein that carries deoxygenated blood from the lower half of the body into the right atrium of the heart, which, here's the right atrium. And then we have the brachiocephalic vein, which is right here. And so the brachiocephalic vein formed by the union of each corresponding interior jugular vein, which the interior jugular vein is usually not visible. However, this is the exterior jugular vein, as well as this one. And the external jugular vein receives the greater part of the blood from the exterior of the cranium and the deeper parts of the face. The interior jugular veins are paired, collecting the blood from the brain, the superficial parts of the face, and the neck. The subclavian veins. Here's the subclavian vein. And the subclavian vein is to empty blood from the upper extremities and carry it back to the heart. The subscapular vein, which it's not as blue as it should be right here, but this is where it goes down deep into the scapula. And that vein is formed by the confluence of the thoracic dorsal and circumflex scapular veins and accompanying the scapular artery to drain into the axillary vein. The axillary veins is right here in the axilla. And this is a large blood vessel that conveys blood from the lateral aspect of the thoracic, axilla, and upper limb toward the heart. Here's the brachial vein. And the brachial vein joins the basilic vein to form the axillary vein. It's small and drains blood from the muscles to the upper arm. And the azygos vein, which is back here behind the heart, as soon as you can see here it is. The azygos vein. And so that is a vein running up the right side of the thoracic vertebra column, draining itself towards the superior vena cava, connects the systems of superior vena cava and the inferior vena cava, and can also provide an alternative path for blood to the right atrium, which again, the right atrium would be right there.